Most men over 60 believe that losing their erection, their desire, and even their sense of masculinity is just part of aging. But after 30 years as a urologist, I can tell you something that may shock you. What you're experiencing is not simply age. It's the slow shutdown of blood flow, hormones, and habits that no one ever warned you about. And if you ignore it, it doesn't just affect your body. It quietly takes away your confidence, your intimacy, and the feeling that you are still yourself. I'm Dr. James, and I've sat across from thousands of men who whispered the same painful words, "Doctor, I don't feel like a man anymore." But here's what most of them didn't realize. The problem wasn't permanent, and it wasn't inevitable. In many cases, it was something surprisingly simple, something hidden in daily routines, even in the way they were using something as common as baking soda, that was holding their body back from functioning the way it was designed to. In this video, I'm going to show you exactly what's going wrong inside your body and how to correct it the right way. But first, you need to understand one critical truth: why blood flow begins to fail after 60, and what that really means for your prostate, your testosterone, and your performance. 1. Why blood flow declines after 60 and what it really means. Let me be very direct with you. What you're losing is not your masculinity. It's your blood flow, and that changes everything. After the age of 60, one of the most overlooked shifts in the male body is the decline of nitric oxide, the simple signal that tells your blood vessels to open and allow blood to move freely. When that signal weakens, your circulation slows down. And when circulation slows down, your body cannot respond the way it used to, not in your energy, not in your prostate, and certainly not in your ability to achieve or maintain an erection. I see this every single day. A man in his late 60s or early 70s comes in and says, "Doctor, I still have the desire, but my body just doesn't follow." That's not a coincidence. That's biology. Without proper blood flow, the tissues in the penis don't receive enough oxygen. The erection becomes weaker, shorter, or disappears altogether. At the same time, poor circulation increases pressure around the prostate, which is why many men start waking up 2 or 3 times a night to urinate. Then comes the fatigue, the frustration, the quiet loss of confidence. I remember a patient named Alan, 72 years old. He told me he started avoiding intimacy, not because he didn't care, but because he was afraid of failing. That fear slowly created distance in his marriage, and what hurt him most was not the physical change. It was feeling like he was no longer himself. But here's what I told Alan, and what I want you to understand. This is not the end. This is not just old age. This is a signal that your body needs support. And when you improve blood flow, everything begins to change. It doesn't happen overnight, but it happens. So the first step is simple. Start paying attention to your circulation. Move your body daily, stay hydrated, and most importantly, understand that what you're experiencing can be improved. But here's where most men go wrong. They try to fix this with one single solution, and that mistake is exactly what we need to talk about next. 2. The biggest mistake men make when using baking soda. Let me tell you something most men don't expect to hear. Baking soda is not the problem. The way you're using it is. I've seen countless men over 60 try it after hearing it can improve circulation, only to feel nothing and give up. And that disappointment cuts deep because it reinforces the belief that nothing works anymore. But in reality, the issue isn't your body failing. It's a simple mistake that's blocking the results you should be feeling. Here's what's happening. Baking soda helps reduce acidity in your body, which is important because high acidity weakens nitric oxide, the very signal that opens your blood vessels. When nitric oxide drops, blood flow drops. And when blood flow drops, erections become weaker, harder to maintain, or disappear altogether. But if you take baking soda alone, at the wrong time, or in random amounts, it only creates a small shift, not enough to restore proper circulation. That's why many men feel no difference, and when they feel no difference, they lose hope. I remember a patient named Victor, 69. He came to me frustrated, almost angry. He said, "Doctor, I tried baking soda every morning for a month. Nothing changed." But when we walked through his routine, it became clear. He was taking it after meals, in inconsistent doses, expecting immediate results. Once we corrected that, something changed, not just physically, but emotionally. Within a few weeks, he told me he felt more stable, more confident, like his body was starting to respond again, and that moment mattered more than anything. So here's my advice to you. Stop guessing. Stop treating this like a quick fix. Your body needs the right method, not just the right ingredient. Because when used incorrectly, even something powerful becomes ineffective, but when used correctly, it can become the turning point. And that leads us to the next question you need to understand. What baking soda actually does inside your body and why it's only one part of a much bigger solution. 3. What baking soda actually does inside your body. Here's the part most men never truly understand. Baking soda doesn't boost performance. It changes the environment inside your body. And that distinction matters more than you think, because what's really happening after 60 is not just aging, it's a slow shift in your internal balance. Your body becomes slightly more acidic over time, not enough to feel pain, but enough to quietly interfere with blood flow, hormone signaling, and prostate function. When your body is more acidic, nitric oxide, the molecule responsible for opening your blood vessels, starts to break down faster. That means your circulation weakens. Blood can't move as freely to where it's needed most. And that's when the symptoms begin to show. Erections feel weaker. They don't last. You feel less desire, not because your mind has changed, but because your body can't respond. You may also notice more pressure in the pelvic area, more frequent urination at night, and a general sense of fatigue that doesn't go away with rest. I remember a patient named Leonard, 73. He told me, "Doctor, I still want to feel close to my wife, but my body just shuts down." What he didn't realize was that nothing was shutting down. His body was simply out of balance. Once we began supporting his internal environment, things started to shift, slowly but steadily. He didn't just regain function, he regained confidence. That's what baking soda helps with. It gently reduces acidity. It gives nitric oxide a chance to survive longer and work better. It helps your blood vessels relax again, allowing blood to flow the way it used to. But here's the truth you need to hear. This is only the first step. Baking soda prepares the body, but it does not complete the process. So if you've been using it and expecting a full transformation, that's why you've been disappointed. You've only been opening the door, not stepping through it. And in the next part, I'm going to show you the missing piece, the one simple addition that turns this from a small improvement into something far more powerful. 4. Why you must combine it with citric acid, not use it alone. This is where everything changes, and where most men never go far enough, because using baking soda alone is like starting a fire without adding fuel. You may get a spark, but it won't last. And that's exactly why so many men try it, feel a slight difference, and then lose hope. The real issue isn't that it doesn't work, it's that it's incomplete without the second piece. When you combine baking soda with citric acid and water, something important happens. They react, they fizz, and in that moment, they form a new compound called sodium citrate. Now don't worry about the name. What matters is what it does. This combination doesn't just balance your body's acidity, it helps protect nitric oxide, allowing it to stay active longer. That means your blood vessels can open more fully, stay open longer, and deliver stronger, more consistent blood flow where it matters most. And when blood flow improves, everything connected to it begins to respond. Erections become more stable, energy improves. The pressure around the prostate decreases, which can reduce those frustrating nighttime trips to the bathroom. Even your sense of presence, your confidence, begins to return. I remember a patient named Samuel, 75. He told me, "Doctor, I thought I was done. I stopped trying." But after we introduced this combination the right way, he came back weeks later with a different posture, a different tone. He said, "I feel something again. Not just physically, but emotionally." So here's what I want you to understand. This is not about adding complexity, it's about completing the process. Baking soda prepares the body. Citric acid activates the next step. Together, they create a response your body has been missing. And now that you understand the combination, there's one critical factor left that determines whether you feel the full effect or nothing at all. And that factor is something most men completely overlook: timing. 5. What happens when you mix them correctly? The sodium citrate effect. Now, this is the moment most men overlook, the moment where everything either works or quietly fails. Because when you mix baking soda and citric acid correctly, you're not just combining two powders. You are creating a completely different compound inside that glass. And that compound is what your body actually responds to. When the mixture fizzes, it forms sodium citrate. And this is where the real shift begins. Sodium citrate helps your blood move more efficiently. It reduces the stress inside your blood vessels and protects nitric oxide so it doesn't break down too quickly. That means your vessels can stay open longer, blood can flow stronger, oxygen can reach areas that have been deprived for years, and when that happens, your body starts to wake up again. This is why men begin to notice changes that feel subtle at first, but meaningful. Erections feel more stable, not forced, not sudden, just more reliable. Energy improves. That heavy fatigue in the morning starts to lift. Even the prostate begins to feel less pressured, which can reduce those constant nighttime interruptions. I remember a patient named Walter, 76. He told me, "Doctor, I didn't feel a miracle, but I felt steady again." And sometimes, that steady feeling is exactly what a man has been missing for years. Because what you're restoring here is not just performance, it's function, it's rhythm. It's the body remembering how to respond without struggle. And that's something many men think is gone forever, but it's not. So here's what I want you to do. When you prepare the mixture, don't rush it. Let it fully react. Let the fizz settle. That reaction matters. It's not just bubbles. It's the transformation your body needs. Drink it calmly. Give your body time to absorb it. Because even when everything is done correctly, there is one final piece that determines the outcome. And it's the difference between feeling nothing and feeling everything. And that piece is timing. 6. The right timing. Why most men feel nothing. Let me say this clearly. If you get the timing wrong, you will feel nothing, even if everything else is perfect. And this is one of the most frustrating mistakes I see. Men try the mixture, don't notice a change, and assume it doesn't work. But the truth is, their body simply wasn't ready yet. When you drink the combination, your body doesn't respond instantly. It needs time to adjust. The acidity begins to shift first. Then nitric oxide starts to stabilize. Then your blood vessels slowly begin to open. This process takes time, usually around 30 minutes before you feel anything at all. And the real effect, the moment your circulation is strongest, happens between 45 to 60 minutes. That's when blood flow is smooth, steady, and responsive. That's when your body is actually prepared. But here's what most men do. They take it and expect results within minutes. Or worse, they take it right before intimacy and feel disappointed when nothing happens. That disappointment builds, it creates doubt, and over time, that doubt turns into avoidance. I remember a patient named Edward, 70. He told me, "Doctor, I thought my body was done." But when I asked him one simple question, "How long did you wait?" everything changed. The next time, he gave it time. And his response was completely different, not dramatic, but reliable. And that reliability restored something deeper than performance. It restored trust in his own body. So here's what I want you to do. Be patient. Give your body at least 45 minutes. Use that time to relax, to breathe, to let your system adjust. Because this is not about forcing a reaction. It's about allowing one. And once you understand timing, there's one final piece you must get right, because even perfect timing won't help if the formula itself is off. And that's exactly what we need to talk about next. 7. The correct formula and how to use it properly. Let me be honest with you. This is where most men quietly sabotage their own results. Not because they don't try, but because they guess. They eyeball the amounts, mix it too quickly, or follow random advice online. And when nothing changes, they blame their body. But this is not about your body failing. This is about precision. When you mix baking soda and citric acid, the ratio matters more than you think. Your body responds best when the balance is right. Too little, and nothing happens. Too much, and your system becomes overwhelmed. The correct ratio is simple: 2 parts baking soda to 1 part citric acid. That balance allows the reaction to create sodium citrate properly while still supporting your internal pH. Think of it like tuning an instrument. If it's slightly off, the sound is weak, but when it's right, everything flows. When the formula is correct, your blood vessels receive the signal they've been missing. Nitric oxide lasts longer, circulation improves, and that directly affects how your body responds. Stronger blood flow means better erections, more stability, less fatigue, and even reduced pressure around the prostate. I remember a patient named Frank, 73. He told me, "Doctor, I tried everything, but I never paid attention to how I was doing it." Once we corrected his formula, he didn't just notice physical changes, he felt more in control again. And that sense of control is something many men lose without realizing it. So here's what I want you to do. Keep it simple. Start with about 3 grams of baking soda and 0.5 to 1 gram of citric acid. Mix it in water, let it fully fizz, drink it slowly. And most importantly, be consistent. Don't rush. Don't overdo it. Let your body adapt. Because when you give your body the right formula, it responds. Not perfectly at first, but progressively. And that progress builds something powerful over time. And that brings us to the final piece. What happens when you use this consistently, and how a simple daily habit can multiply your results in ways most men never expect? 8. How to maintain results. Long-term, and the one daily habit that changes everything. Let me tell you something most men don't realize. What you do once may help, but what you do daily is what truly changes your body. And this is where many men miss the final step. They try the method, feel a small improvement, and then stop. And slowly, everything fades again. Not because it stopped working, but because the body needs consistency to rebuild what time has worn down. You see, your blood vessels are not fixed overnight. They respond to patterns. When you consistently support your body, nitric oxide becomes more stable. Circulation improves day by day. Oxygen reaches tissues that have been deprived for years, and that affects everything. Erections become more reliable. Energy returns in the morning. The constant fatigue begins to lift. Even your prostate can feel less pressure, which means fewer interruptions at night and better sleep overall. I remember a patient named Charles, 75. When he first came to me, he looked defeated. He told me, "Doctor, I don't expect miracles anymore." But I asked him to do 2 simple things: follow the method correctly and walk for 20 minutes every day. Nothing extreme, just consistency. A few months later, he came back, and I could see it before he even spoke. He stood taller. He smiled more. He said, "I feel like I'm coming back." Not to who he was at 30, but to someone strong, present, and alive again. So here's what I want you to do. Keep using the method the right way, but add one simple habit. Move your body every day. Walk, breathe, stay hydrated. These small actions increase blood flow naturally and amplify everything else you're doing, because your body doesn't respond to effort once, it responds to rhythm. And if you've been feeling like your body is slipping away, understand this. It's not gone. It's waiting for the right conditions to come back to life. And in the next part, I want to leave you with something even more important than any method, something about who you are and what is still possible. 9. Conclusion. Your body is changing, but you still have control. As you age, your body becomes more sensitive, more fragile, but not beyond repair. What you've seen today is not about chasing youth, but about understanding your body and supporting it the right way. When you improve blood flow, balance your habits, and act with intention, you give yourself a real chance to feel stronger again. The next 1 to 5 years of your health will not be decided by age alone, but by what you choose to do starting today. Stay aware, stay consistent, and most importantly, Don't wait until your body forces you to act.